mean, I think huge everyday work for states and locals. That library of knowledge, the person you turn to because you can't, when you're at the state and local level, it's like you're an ER physician, and that everything that walks in the door, whether it's an outbreak of diarrhea that you're trying to say, did this happen at this restaurant or at this party? If it's an infection that is being seen in a hospital in 4 different patients, and the infection controlled nurse calls you, you at that local level are working with the physicians, the nurses, the schools, the restaurants to try and sort through what is going on and what can we do. You call the CDC or email them to say help. Sometimes that help might be, we're going to send some people to you, an epi-aid. We're going to give you more boots on the ground to help you do this. Sometimes that might be talking to somebody who's one of the only world's experts on a specific type of infection or a specific type of exposure. But being able to do that now, and I talk to my colleagues who work at the state and local level in Virginia a lot, there's nobody to answer the phone. And so now they are working and trying to talk to each other. But as many of you have heard, there's a lot of states are trying to figure out, how do we work together? How do we figure out a way to expand our capacity when we've never really had to do some of these things before? And so I think it has a significant ripple effect. And I think most of the effect it has, we always say public health, you don't know you need it until you need it, because it's in the background. And that is, when you walk into the restaurant, you sort of expect to have healthy food and not get sick when you leave. You don't have to worry about drinking the water that comes out of your faucet. You don't have to worry about if you flush your toilet, where that will end up in your food. And you think when you go to the hospital, it's going to be clean, good care, and that somebody's really coming up with key standards to say, how do we make sure it's the best care? All of those things are being eroded. And so I think at a state and local level, it's very, very scary.